Bismillahirrahmanirrahim. Welcome to On Obs and Gynae channel. In today's video, we will discuss the management of gaped episiotomy, including wound care, treatment, and follow-up. So let's get started. How would you define gaped episiotomy? It is the separation of edges of an episiotomy wound after childbirth, resulting in partial or complete wound adhesions. It may occur with or without infection and can delay healing, cause pain, and increase maternal morbidity. The causes or etiology of gaped episiotomy include infection as the most common cause, hematoma formation, poor surgical technique, increased tension on the wound, trauma, patient factors, early mechanical stress. The clinical features of gaped episiotomy include severe perineal pain, feeling of wound opening, vaginal bleeding or spotting, foul-smelling discharge, fever if it is infected, difficulty in sitting or walking, dyspareunia which occurs at the later stage, delayed wound healing. How would you take history from the patient with a gaped episiotomy? Ask about pain, fever, discharge, bleeding, an effect on the quality of life, difficulty in sitting, etc. How do you do examination of patients with a gaped episiotomy? First of all, inspect the perineum for gaping wound edges. Look for the signs of infection, any pus, the presence of necrotic tissue, degree of wound separation. Also assess the anal sphincter integrity, the rectal mucosal involvement, and the signs of systemic infection. What investigations are done in patients with gaped episiotomy? Usually, it is a clinical diagnosis. If infection is suspected, do complete blood picture test of the patient, C-reactive protein or CRP, wound swab for culture and sensitivity, blood culture if septic. If hematoma is suspected, ultrasound is very important in such cases, but it is rarely required. Now, the management of patient with gaped episiotomy. The management depends on whether the wound is infected or clean. In case of infected gaped episiotomy, do not do the resuturing immediately. So the main steps of treatment of infected gaped episiotomy include removal of infected sutures if present, drain pus if collection exists, wound irrigation with a normal saline, broad spectrum antibiotics, adequate analgesia, daily dressing, sitz bath after 24 to 48 hours, stool softeners, good nutrition, perineal hygiene, allow healing by secondary intention, or consider delayed secondary repair once the infection has resolved. How do you do the treatment of clean, non-infected gaped episiotomy? If no infection and there is healthy tissue, early presentation, usually within 48 hours, resuturing can be offered. Benefits of resuturing include faster healing, less pain, earlier return to normal activities. Antibiotics of choice for gaped episiotomy: broad spectrum coverage against the skin and anaerobic organism. Example include coamoxiclav, cefuroxime plus metronidazole, clindamycin if penicillin allergic, and adjust according to culture results. The pain relief in gaped episiotomy include paracetamol, NSAIDs if not contraindicated, ice packs during the first 24 hours, sitz bath after acute swelling subsides. Local wound care in case of gaped episiotomy: keep perineum clean and dry, wash with clean water after urination, change sanitary pads frequently, front to back wiping, avoid antiseptic solution unless indicated. Constipation prevention in gaped episiotomy is very important, and that is done by the use of high fiber diet, adequate fluids, stool softeners like lactulose, and advised to avoid straining. How would you do follow-up of patient with gaped episiotomy? Review within 1 week, then as needed. Assess the wound healing, pain, signs of infection, urinary symptoms, bowel function, anal continence, sexual function after healing. If healing is poor or symptom persist, refer to urogynecologist or colorectal surgeon if sphincter injury is suspected. The complications of late episiotomy may be early or late. The early complications include infection, abscess, hematoma, persistent pain, delayed healing, and wound adhesions. The late complications of gaped episiotomy include dyspareunia, perineal scarring, chronic perineal pain, cosmetic deformity, psychological distress, pelvic floor dysfunction, which is rare condition. The prevention is done during delivery and after delivery. How to avoid gaped episiotomy during delivery? Perform episiotomy only when indicated. Avoid routine use. Use a mediolateral episiotomy, which is 60 degrees from the midline at crowning. Support the perineum during crowning. Deliver the fetal head in controlled manner. Avoid unnecessary instrumental trauma. Achieve meticulous hemostasis before closure and close the wound with correct layer technique using absorbable sutures. Now we will discuss after delivery care in case of gaped episiotomy. Maintain good perineal hygiene, keep the wound clean and dry, provide adequate pain relief, encourage early ambulation but avoid heavy lifting. Prevent constipation with a fluid, fiber, and stool softeners. Identify and treat hematoma or infection promptly. Optimize maternal nutrition and correct anemia. Educate the mother to seek medical care if she develops increasing pain, fever, foul smelling discharge, or wound separation. So thank you for watching. I hope this video was helpful. For more Obs and Gynae educational video, please like, share and subscribe to On Obs and Gynae channel. See you in the next video. Allah Hafiz.